use standardized periodic tests to be able to assess the impact of the training that we are giving, then clock-in sessions. We need to make sure that the people we have trained to be there will be there, just not because we would have projectors, they would go away and leave the screens there for the people. We would have quarterly visits as described, and then we would engage the parents, the church heads, and then traditional heads. This is the spectacular idea we have put together. We hope you love it.
One of the things that was impressive for me was the fact that it looked like it was holistically thought through, and then there was an investment angle to make sure the project is sustainable. I thought that was very brilliant. But something that was a big cause for me of worry was I didn't see your objectives translating directly into your indicators. Usually when you have KPIs, what you would expect is the KPIs are some form of a measure of your objectives. But there was some disconnect between the objectives and then the KPI. And then my last comment was looking at the statistics you had given. It spoke more to the children, but your problem said there were lack of teachers. So I expected to see statistics on what the lack of teaching or teachers were, rather than statistics on how many children were untaught, because it looks like the problem is there, but the bigger issue which you had presented was there were no teachers. So the question is, how many teachers are unavailable? What are the statistics between the student and the teacher and the pupil ratio? So.
The Challenge will be right back. Welcome back to The Challenge, where we've seen Archers and M2 Rock face the panel on the Digital Changemakers task by Tigo. Up next, the Tigers.
We believe the noblest thing we can ever do is to help the weak and fragile in society. And the Tigo Reach for Change is one such initiative aimed at improving the lives of children in Ghana. And that really drives our passion and our motivation to change their lives. Now, as digital change makers, we're required to identify a problem in society and use technology to solve it. In our readings, we came up on startling information. We realized that there were inadequate health facilities in Ghana. It will interest you to know that out of the 24.5 million people we have in Ghana, per the 2010 statistics, only 1,500 health facilities caters for all of us. Now, out of the 24.5 million, we have 38.3% of this percentage being children. The question that begs asking is what percentage of these 1,500 health facilities caters for children? Now, there's high infant mortality rate in Ghana. It will interest you once again to know that we are losing close to 80,000 children before their 5th birthday. And to me, that is very worrying. Malaria alone claims 22,000 young lives before they reach their 5th year. Acute respiratory infection diseases is also responsible for 18% of all under 5 deaths. Diarrhea for another 18%. Malnutrition is also an underlying cause of most of the deaths we have for under 5 children. Now, there's inadequate human resource in rural communities. The doctor-to-patient ratio we have in Ghana today is 1:15,259 per year, according to the Ghana Health Service. Now, World Health Organization requires that every country should have 1:6,000. That is 1 doctor to 6,000 residents. And in our country, we have only 1:15,250. Now, majority of child mortality cases are recorded in rural areas. And over the past 3 years, out of the 13 doctors that were posted to rural areas, only 1 of them reported. That is in areas of the Upper East and the Northern regions. And to me, that is very, very disheartening. Now, we've realized these problems. That gave us as a team a vision to do something. Now we've set out to first and foremost expand healthcare to various aspects of our countries, particularly the rural areas. We also set out to improve the care of infants and children, particularly in the remote areas. We also seek to build capacity for health professionals, increase quality of life, and cost efficiency. We are also looking to reduce burden of travel and also overcome substantial barriers, be it political, be it professional, and also lastly, empower our patients to also take a stand in issues that affect their health.
In line with our vision to make health accessible for children in rural areas, affordable, and to make it such that children can be able to